for tipplers. Are you someone who enjoys a glass of wine or a drink of single malt every evening? Well, then this story is for you. A new study claims that routinely drinking alcohol, even as little as 1 drink per day, is linked to elevated blood pressure, even in adults without existing hypertension. The research has been published in the American Heart Association's journal called Hypertension. Now, it analyzed data from 7 international studies conducted between 1997 and 2021 and found that individuals who consumed just 1 alcoholic beverage daily had a higher likelihood of experiencing increased blood pressure compared to those who abstained from alcohol altogether. Dr. Marco Vincetti, the senior author of the study, says, and I quote, "We found no beneficial effects in adults who drank a low level of alcohol compared to those who did not drink alcohol. We were somewhat surprised to see that consuming an already low level of alcohol was also linked to higher blood pressure changes over time compared to no consumption, although far less than the blood pressure increase seen in heavy drinkers." The analysis included data from over 19,000 adults in the United States, Korea and Japan. To ensure consistency across countries with varying types and sizes of beverages, alcohol consumption was measured in grams rather than the number of drinks to measure a standard drink. The World Health Organization, for example, sets the standard at 10 grams of alcohol per drink, while the US defines it at 14 grams. The study found that the negative impact of alcohol on systolic blood pressure continued to rise over the years, even in men and women who drank little every day. The study's co-author, Dr. Paul Welton, says both systolic and diastolic readings contribute to cardiovascular risk and go hand in hand. But of the two, systolic blood pressure is definitely the most important risk factor in adults. Now, as we said, the review analyzed data from 7 studies conducted in Japan, South Korea and the US between 1997 and 2021. It followed more than 19,000 adults between the ages of 20 and 70 who had no prior diagnosis of alcoholism, binge drinking, cardiovascular disease, diabetes or liver disease over an average 5-year span of time. All participants were asked about their typical alcohol intake. Researchers then used statistics to plot how various amounts of alcohol affected blood pressure over time. Drinking an average of 12 grams of alcohol a day or less than 1 US standard drink produced a small rise in systolic pressure of 1.25 mmHg over an average of 5 years. In people who consumed an average of 48 grams of alcohol per day or nearly 3.5 standard US drinks, systolic blood pressure rose nearly 5 mmHg over the same time frame compared with non-drinkers. The report authors say that would certainly move you from pre-hypertensive to hypertensive, just as eating an excessive amount of sodium, too few fruits and vegetables, and not getting enough physical activity will push you in the wrong direction. Now, a person's systolic blood pressure reading, which represents the force of blood against artery walls when the heart contracts, is a major risk factor for cardiovascular disease for people over the age of 50, according to the American Heart Association. The low diastolic reading measures pressure in the arteries as the heart muscle rests between beats. A normal systolic reading is typically 120 mmHg or below, but tends to rise as blood vessels weaken and narrow with age. A normal diastolic reading is below 80 mmHg, but begins to decline with age as arteries lose their elasticity and stiffen at times, leading to an increase in the pulse rate. However, the study authors have a caveat. They say alcohol is certainly not the sole driver of increase in blood pressure, but the findings confirm that it contributes to it in a meaningful way. Therefore, limiting alcohol intake is advised and avoiding it altogether is even better, they say. Dr. Andrew Freeman, Director of Cardiovascular Prevention and Wellness at the National Jewish Health in Denver in the United States, has reacted to the study saying, "To me, this is yet another study showing there may not be any safe amount of alcohol." But over the years, has there been confused alcohol messaging? How do these study results fit in with past research that has shown alcohol may be beneficial for the heart? For one, many of the older randomized clinical trials only compared light drinkers with heavy ones and not to those who didn't drink at all. The authors of the study say, from a blood pressure perspective, most people would agree that there is no level in which alcohol is safe. However, from a cardiovascular point of view, you may get mixed opinions. Studying alcohol use is difficult because it's associated with behaviors that can be both helpful and unhelpful. They argue, if you're drinking in a smoke-filled bar at night with friends, your exposure to second-hand smoke and alcohol will certainly disrupt your sleep, and both are harmful to health. But you're also getting the positives of socialization. Now, research on blue zones, areas of the world where people typically live up to 100 years and beyond, has shown that diets in these locations often include small amounts of alcohol that are routinely consumed with dinner. So, is it the alcohol that helps longevity or the tight social networks? The authors say, we don't recommend people start drinking. If they do drink, they should try to really minimize it and then do their best to maintain healthy behaviors that help the heart, such as exercise and stress reduction. Exercise is an amazingly effective way to lower blood pressure, both systolic and diastolic, as it helps the heart relax and maintain better efficiency. So there you have it. Doctors would say, give up drinking altogether if you can, and if it's too hard for you, then drink in small amounts. And definitely do not forget to exercise, because that's what the doctor has ordered. Well, that's all the time we have on this edition of Global Lens on News9 Live. If you have been, thanks so much for watching. But we're leaving you with the special News9 Plus documentary on India's first Prime Minister, Jawaharlal Nehru, and Kashmir's accession into India.
China won't let us rest easy on our borders, but they will keep flooding our markets. What does Xi Jinping really want?
I think he wants the Indian market, no doubt about it.
It's really a matter of showing their dominance.
India's great Chinese conundrum.
Nobody can